How's it going, guys? We have a pass level question for pathology for step 1. 39-week gestation neonatal male. He's in ICU. He's got a 4-on-6 holostolic murmur at the left sternal border. This is going to be a VSD, okay? And obviously, holostolic could also be mitral regurg, or it could be tricuspid regurg, the latter if it increased with inspiration. But you got to think about your demographics. It's a long discussion. You're not going to have mitral regurg in a neonate. You're not going to have tricuspid regurg either, okay? And they don't have to say lower left sternal border. They can just say left sternal border. Physical exam shows a cleft lip and palate, so the combination of a heart defect with a cleft lip palate, this is velocardiofacial syndrome or DeGeorge syndrome, okay? It's 22q11 deletion. And you can get tetralogy of Fallot, you can get truncus arteriosus. So when you have this VSD here, you could opine or conjecture that maybe it's combined with the pulmonic stenosis. Pulmonic stenosis and tetralogy of Fallot would be mid-systolic, but if you have a VSD overriding aorta, they can just say harsh systolic. Okay, so right ventricular hypertrophy, VSD overriding aorta, pulmonic stenosis for tetralogy of Fallot. What's most likely to be seen in this patient if we have DeGeorge syndrome? Choice A, genesis, third and fourth pharyngeal arches, wrong fucking answer. OMG, it's not the arches, it's the pouches. It matters. Okay, you really got to know that. So it's not, and you don't need to just know this in isolation. You have to know what each of these becomes independently. In other words, the third pouch, not arch, is going to be the two inferior parathyroids in the thymus. The fourth pouch will be the two superior parathyroids. Tangentially, they can give you an unrelated question where they say something like a woman has a parathyroid adenoma, a left superior parathyroid adenoma, and they'll ask you embryologically it's due to what, and the answer is fourth pharyngeal pouch, where third is wrong. So there are questions where they want you to be able to distinguish that. Wrong fucking answer. Choice B, calcium 10.5, wrong fucking answer, okay? You could start conjecturing about different ranges in neonates. Doesn't fucking matter because 8.4 to 10.2, traditionally, that's going to be our normal range. And if anything, we would have low calcium, not high calcium. Clearly, it's a high number. Okay, so 8.4 to 10.2. I know some of you don't have the lab values in front of you. Maybe you didn't know that. You got to take your training wheels off. Okay, but low calcium, it's because you have agenesis of the parathyroid glands in DeGeorge. Okay, so it's a down arrow for PTH, and that's going to cause a down arrow for calcium. Choice B, wrong fucking answer. Choice C, decreased neural crest migration, correct answer. Now, even if you didn't know this, which, by the way, decreased neural crest migration in DeGeorge syndrome is what's going to cause agenesis of the third and fourth pharyngeal pouches, also contributes to the heart defects. But let's say you didn't know that, okay? I say it's still pass level because you can easily eliminate the others. Well, maybe choice C is a bit difficult. Maybe it's medium difficulty, okay? But choice C is the answer. Let's just quickly whip through the others. Choice D, wrong fucking answer, because you're going to have decreased T cell production / decreased T cell maturation, not B cell, okay? Because you have the absent thymus and DeGeorge, part of the third pharyngeal pouch, agenesis. Reduced maturation of B cells could refer to CVID, common variable immunodeficiency, teenager, young adult, who's going to have recurrent sinopulmonary infections. It can present very similarly to IgA deficiency. You're going to check serum immunoglobulins. If IgA is down, it's just IgA deficiency. If they're all down, it's CVID. Could also, if you got a kid, you could say maybe this refers to Bruton. Bruton is more a failure of development of B cells rather than CVID is more about the failure of maturation of B cells into plasma cells. Point is, wrong fucking answer. Choice C, short QT, wrong fucking answer. You can see this with hypercalcemia. That's a bit difficult, actually. I made clips on it before if you've been following my content, but all you need to know, don't worry about mechanisms. Okay, it's just pass-fail step 1. That's all I want you to know. Hypercalcemia can cause a short QT. Hypocalcemia can cause a long QT. Okay, so hypocalcemia, all right, so cause of long QT syndrome, but clearly we'd have low calcium, as we've already discussed in DeGeorge syndrome, which would cause a long QT, if anything, not a short QT. Choice E, wrong fucking answer. You know the deal. I'm going to make more content on my subscription. Appreciate your time. That's it.